The U.S. sounds an alarm after new Chinese pneumonia outbreak raises serious questions and concerns. And the article says that U.S. officials began expressing concerns this week about a new outbreak in respiratory illnesses in China that have sent a surge of children to the hospital. NBC News reported that the outbreak in northern China has caused hospitals to become overwhelmed with sick children. According to ProMed, a publicly available reporting system for emerging diseases and outbreaks. The news comes after COVID-19 began spreading in Wuhan, China in late 2019, and in the span of a couple months threw the entire world into a global pandemic that killed millions and was used by governments to implement draconian measures. Yep. Now, as far as the killed millions thing, I would like to revisit that and tell you that all of the PCR tests, the died with COVID or died of COVID are serious things that we need to revisit and stop saying there's millions of people who died as a result of COVID, when you have to understand that there was actually somebody who got bit by a shark and died as a result of being eaten by a shark and was considered a COVID death because they had tested positive for COVID at the time. And then you have to take that a step further and understand that not only were they marking people dead with COVID so that they could make their money because they were incentivized off of this, because this is all stuff we can't let seep through our memory, people. We have to understand the lengths that they went to for this propaganda campaign. One being that it wasn't died of COVID. What was important was died with COVID, that they would mark as of COVID. The second thing is, even when they ran those tests and said that they died with COVID, they ran the tests with PCR testing at cycles that were way higher than what was supposed to be allowable for PCR tests to be accurate whatsoever. And then as things wound down, guess what they did? They lowered the cycles on the PCR tests so there wasn't as many false positives. So when you're talking about millions of people dying, you have to understand that the real number of people that died of COVID is far, far, far less than what was reported originally. Because first of all, as we just talked about, they marked people dead with COVID as of COVID. They marked people with COVID incorrectly because the amount of cycles they were doing on PCR tests, which was far above the allowable, at least justifiable amount of cycles. It's like anything above 19 cycles is a very high rate of false positives, right? You go back to the podcast I've done about Carrie Mollusk, you go read who actually came up with PCR testing, Nobel Prize winning laureate scientists who designed the PCR test. And it's really interesting if you go back and listen to some of those episodes, even episode 1, right? I'll mention that a couple times, is assassinations, cover-ups, and the cult of science that I did. I highly recommend you listen into that podcast. I haven't gone back and listened to it myself in a while, but it's the very first one I ever did. So cut me some slack. But I think there was a lot of value in there. And I went through that book that I discussed last week, Code Blue, about the medical industrial complex. So a pretty good one. But I highly, when we're talking about millions of people dead, you have to remember the context. You cannot forget that when we talk about that. All right. So it says China's recent pneumonia outbreak raises serious questions, and the World Health Organization is asking them, said U.S. Ambassador to Japan, Rahm Emanuel. It's time to abandon COVID deception and delays as transparent and timely information saves lives, he said. Full cooperation with the international community is not an option. It's a public health imperative. Will Beijing step up? And this is the ambassador that actually tweeted that. So there's the exact tweet. NBC News says that it witnessed long lines and crowded waiting rooms at Beijing's Children's Hospital. And this is, again, when you see the word children, right? Why would something be specifically affecting children? Children generally have much better immune systems than you and I, or even older individuals, right? The reason for that is, well, they're young, they're healthy, their antibodies are much more aggressive in dealing with these things. Their hearts are healthier than ours, their lungs are healthier than ours. Lots of reasons, but it says the WHO said in a statement that today WHO held a teleconference with Chinese health authorities in which they provided requested data on respiratory illnesses among children in northern China. The data indicates an increase in outpatient consultations and hospital admissions of children due to mycoplasma pneumonia since May and RSV, adenovirus, and influenza virus since October. You mean we're going into December and we have a rise in flu cases? What will we do? It's almost like this has happened every year since humanity's existed. The WHO continued. Some of these increases are earlier in the season that historically experienced, but not unexpected given the lifting of COVID-19 restrictions, as similarly experienced in other countries. Yeah, okay. They've already cried wolf, and like nobody will literally believe them. If there was a flesh-eating zombie disease at this point, I think you would still have a large portion of the country in complete disbelief, right? The boy, let's go back to the boy who cried wolf, right? Or the government who cried pandemic is probably a more accurate one. It goes on to say, the COVID-19 pandemic was marked by lying and deception from communist China about the origins of the coronavirus, as well as attempts to cover it up. The World Health Organization was also accused of not being forthcoming with what it knew about the coronavirus and of trying to cover for China. Yes, we know all of this. All right. Cool. So there's your article on that. So to me, they've come out now and said that this is not a novel virus, that it's not something that they have not seen before. So they've said, it's nothing to be concerned of until, it's not like last time, right? Until it is something to be concerned about.